I want you to know that in exchange for being in this somewhat darkened room in the morning, we're going to be able to eat lunch out on that sunny terrace. It's going to be a perfect day for it. I'm Arnie Milstein. Welcome to Stanford. This will be the sum total of my introductory remarks. We want to get back on schedule. As is laid out in the agenda, we'll begin with opening comments from Brent Barnhart, the director of DMHC. Brent?
No. You're good, sir? You're good.
Good morning.
Morning.
Thank you. My name is Brent Barnhart. I am currently the director of the Department of Managed Healthcare, and the reason for the adverb currently is that I am retiring, if you've heard the news. So this is my last opportunity to address you as director. I'll be with the department through the month of November, and then on December 1st, I'll be succeeded by our current chief deputy. Shelley, why don't you stand up? Shelley Love. So, welcome to the 6th Annual Right Care Leadership Summit. Thank you, first of all, to Stanford for hosting this meeting and ordering the weather, and to all the staff who worked to put all this together. This public-private partnership would not be possible without our sponsors, of whom Hattie will go into in some detail, and thoroughness and accuracy. Today we'll focus on a few key proxy measures that indicate whether patient care is being proactively managed in critical areas of performance that are important in terms of preventive disability and death, measurable and scientifically clear. As a regulator of managed care, I honor the plans, groups, and clinics who actively share best practices here today, and between the summits, improving the uptake of promising interventions to improve patient outcomes. I'm here also, as I think I've mentioned at previous events, I'm also a survivor of a heart attack, and so all this has some personal meaning to me, and the kind of care that I've gotten subsequent to that event about 4 years ago. And I realize on a very personal level how important the various kinds of approaches that you're dealing with and presenting on today. We will then see what we can learn today about how better to prevent heart attack, strokes, amputations, and blindness. The expertise and the energy in this room is significant, and I really am delighted to be here and have an opportunity to observe and to hear the interaction that you're going to be engaging in today. So thank you for being here.
Good morning. I'm Steve Shortell. I'm a professor of health policy and management at Berkeley and Dean Emeritus. And the important part of that is the emeritus part of that. Underlying that, I have not yet advanced to Brent's exalted state of full retirement. Very active with teaching and research program at Berkeley, and happily so. But I just want to add my welcome to Arnie and Brent's. And let me ask those of you out there, how many of you are here at the summit for the first time? Just to kind of raise your hand. Fair number. And maybe how many of you, actually this is your first experience with the Right Care Initiative, because some of you may be involved in other ways. This may be the first time at the summit. But how many of you, this is your first touch, so to speak, of the Right Care Initiative? Okay, great. Welcome again. I also want to thank our sponsors of this, and I'm going to read them off and then ask you maybe to stand briefly to be acknowledged, because we could not do this without you. This has truly been a virtual community, a virtual family that's grown over the last 6 years, thanks to the efforts of an awful lot of people. But no particular order, the California Chronic Care Coalition, Boehringer Ingelheim, the California Healthcare Foundation, the Patient Advocate Group, Stanford University hosting us here today, the generous support of Judith and Jack White down in San Diego. They made a really major gift that launched the University of Best Practices in San Diego. And Hattie and all of her leadership team have now spread that to Sacramento and also to Los Angeles. And so Judith and Jack White. Health happens here. That's the California Endowment. Novo Nordisk, I know, has been a big supporter. Ralph's Grocery Store, the Sierra Healthcare Foundation, Genentech, and the Health Services Advisory Group. So if any of you are associated with any of those organizations or want to claim to be, please stand up and receive acknowledgement. Thank you very much for all of your support. I just want to say a couple words about the day, which is how we might maximize learning. And I'd like to suggest that one way of doing that is to try to get outside our comfort zones. And by comfort zone, I mean the things we think we know about how to improve care for diabetics, heart disease, prevent strokes, and so forth, to really listen to each other in the breakout sessions and in the other sessions we have, and kind of think about 2 or 3 questions. One is why, the why question. You know, why are you doing this rather than something else? And a second question is how. How are you going about doing that? Because one of the great challenges we have is to transfer and spread best practices from one site to another. You know, they take into account the contextual differences that exist among different delivery entities and so forth. So how are you doing it there? What might be generalizable? What do I need to do in my organization to adapt it to get some of those same results? And the third question, of course, is what? What results are you, in fact, getting? So one way of thinking about this is a day to make what might seem strange familiar. The strange part is outside of our comfort zone. You'll hear Arnie and his colleagues talking about something that may seem, gee, that's kind of weird, different. Arnie's made a career of that, by the way, highly successfully, because people begin to see the results, and it does involve change. What seems strange becomes more familiar, but also the opposite. How you're going to make the familiar strange, okay? So I think if we can do that today, and then to end the day, my suggestion would be, what are you going to do differently Tuesday morning, back in your own organizations? Because if you're not going to think about doing something differently to advance, to fill a gap, then maybe this was a nice session and intellectually stimulating and so forth, but it will have been sub-optimized. And our time is too valuable to have it sub-optimized. So I hope at the end of the day, you will go back and push things forward with the wonderful work you're already doing. Thank you very much. Now, Hattie is really everything behind this, has kept it going for 5 or 6 years as our spiritual force and a lot of other forces. I like to say there are forces of nature, and then there are forces of nature, and then there's Hattie Hanley.
And then there are the patients. And the patients are what this is all about. I'd like to ask Liz Helms, the President and CEO of the California Chronic Care Coalition, to please put these flowers at her table and also collect from Martha Garrity's table the sign that says Patient-Centered Care. And let's all just keep in mind today, this is what it's all about. The patients at the center of the care. And with that, I want to pose one intellectual challenge for the day. And that is, before we see Steve Shortell present the data, I can tell you that we consistently see that patients served in the IPA model don't appear to be getting the levels of control for blood pressure, for lipids, and for blood sugar that would help us to prevent those heart attacks, strokes, amputation, and blindness. So for all these amazing straight A students in the room, every single person in this room is somebody who was at the front of the class, even in medical school. So I want to just ask you that question and have you ponder during the day. How do we bring better control to the patients in California? These are things we know how to do scientifically, and we're just not doing them. So it's for this group to together, collaboratively, figure it out. And for anybody who comes up with a new idea of how we can get more of the IPA model patients in good control, I have a very fine bottle of Mount Vernon wine in my car that awaits you. So with that, are we ready to have the NIH video feed join us?